In the governor's budget document, there was a new line item called access to reproductive health. And while I understand that obviously the issue of abortion is an extremely divisive one, and I don't really want to get into the policy of that, but one of the things that has been standard in Pennsylvania policy on this issue in the past has been not allowing tax dollars to go towards funding abortions. So could you talk a little bit about this line item to assure this committee that this is not a break in policy?
Absolutely. Thank you for asking the question and giving me that opportunity. So this funding is to go to Planned Parenthood, and none of this funding will be used to support abortions or to provide for abortions.
But Planned Parenthood is the largest abortion provider in the state. So what exactly is the mechanism to ensure that these dollars don't go specifically to abortion?
So paying for abortions with state dollars or federal dollars that are appropriated through the state is illegal in Pennsylvania, except in very rare circumstances. These providers, including Planned Parenthood, already have to comply with that law. So they provide family planning services and abortion services, but they are separate, both financially and physically. They also have to have an independent audit that shows that that separation is occurring, and we actually provide information and a report to this General Assembly that has that information in it. So they're very familiar with keeping these separate, and this
and I think that's something that we want to watch, because of course, is, you know, let's just say an extra $300,000 or an extra whatever it is that goes into it can be, you know, what I want to be looking for is that being offset then somewhere else, where all of a sudden we're seeing numbers go up on the abortion side. I mean, it can be somewhat of an accounting gimmick, and you know, if we could kind of see what those, what the barriers or the guide rails that are in place, I would appreciate that. I know, and I think members of the committee would as well. I want to make sure, though, we're clear. The administration's position is that to continue with taxpayer dollars should not go towards funding abortion services.
And by state law, they can't.
Okay.
That's right.
And then the other question I have is in regards to what looks to be a somewhat new program that was started last October by the administration, and an expansion of Medicaid benefits, including home visitation services for first-time mothers and mothers of children with special or additional risk factors. I know that we have members of our caucus that have been extremely passionate about postpartum issues and have been trying to work with stakeholder groups to come up with solutions moving forward that we can implement, make sure we're doing the right things and addressing this very critical and real need for mothers all across Pennsylvania. And my concern is it looks to me, and you can correct me if I'm wrong, that we're starting a new program without legislative oversight or approval, or with any of our experts to be able to talk about issues and stakeholder meetings. It just seems like this kind of came about, and I'm concerned that that might undercut the efforts of this body to try and get something that we believe will really work throughout Pennsylvania on this issue.
So let me just clarify and correct your understanding a little bit, because I can understand where you may have been confused. But we didn't start a new program. What we did is we have something that is currently in rates and currently funded called community-based care management within our existing rate structure for our managed care organizations. And this is really about trying to get care where people are and serving them and kind of meeting them where they are and addressing the needs that they have. So what we did is essentially define community-based care management for our MCOs and said, within this already existing bucket here, we want you to provide home visits, 2 home visits, in addition to home visits that are already available, so that we can continue to connect people to resources that might be able to help with address their social determinant or other health needs, make sure babies are
So this was in the budget last year?
Yes. The particular having the money go to home visiting was not specified in the budget, but community-based care management was absolutely in the budget.
But it's the same amount. It's the same amount of money.
It's the same amount of money.
Are we asking for an increase this year?
So this year, what we're asking for is an additional $1.3 million, I think, in state funding.
Is that for the entire bucket as you described it, or is that specifically for what we're describing here?
This would be to further expand that. So all we're talking about now with what we've announced so far is 2 home visits. What we hope to do with the money that we've proposed in the budget is to further expand that program. And really...
But that does sound like we're looking to expand on this program, not just something...
Only if that gets approved in this budget. Otherwise, we'll still be with 2 home visits.
Okay, so that stays regardless, and then the expansion comes with more funding.
Right.
Okay. Thank you, Mr. Chairman.